Welcome to the deep dive. So today we're looking at something pretty fascinating, this link between ancient wisdom and, well, cutting-edge AI.
Yeah, it's a wild one. Imagine GPT, the AI everyone's talking about.
Right.
It looks at the work of this modern doctor, Dr. Kadali Srivatsa, and compares him not to another modern figure, but to Charaka.
Charaka, the, father of ancient Ayurveda from over 2,000 years ago.
Exactly. It
Yeah.
seems, almost impossible.
Yeah.
How do you even connect those dots across that much time, that much change in medicine?
What could possibly bridge that gap? It's quite the hook.
It really is. And digging into why the AI made that connection,
Yeah.
It tells us something pretty deep about healthcare itself, what it's really for, then and now.
Absolutely. So that's our focus today. We're diving into Dr. Srivatsa's story. We've got his autobiography, some really interesting chats he actually had with ChatGPT, and various reports on healthcare systems. Our sort of mission here is to unpack his journey, what led him to focus so hard on patient empowerment, on prevention. How did this simple idea grow into Dr. Maya GPT?
And the big question, why didn't AI see this parallel to ancient wisdom?
Yeah, it's a real deep dive into that intersection of, personal history, system problems, and tech solutions in healthcare.
We're getting into the work and really the whole story of Dr. Kadali Srivatsa.
Yeah, a doctor with, over 40 years of experience?
Exactly. And his journey, at least as it's laid out in the sources we have, it really involves pushing back against conventional healthcare ideas.
And facing some pretty serious hurdles, personally and professionally.
Right. And developing a unique solution for public health.
So just to be clear on what we're working with today, we've got bits from his autobiography, some other writings he's done,
Right.
articles looking at his work, especially this thing called the Dr. Maya app.
Ah, yes, the app.
And even a little bit of, historical background on medical changes in healthcare systems, just for context. It's quite a mix of stuff.
Got it. So our mission here is to really understand, just based on these sources, what makes Dr. Srivatsa tick. What problems does he see? What's his proposed fix?
And the challenges he says he faced?
Right.
Big ones.
Yeah, exactly. We want to give you, the listener, a clear view of his perspective straight from this material.
Okay, so where do we start? The big threat, right? Superbugs.
Yeah, he sounds the alarm pretty loudly on this one.
He does. The sources quote him using, incredibly strong words like a holocaust.
Wow.
Yeah. Describing them as fast, deadly, and, crucially, nothing really stops them right now. No magic bullet medicine, no vaccine.
And the prediction mentioned is pretty grim.
Very. That they could massively increase deaths each year. The source even mentions a potential extinction by 2060 if we don't change course. Stark stuff.
So where does this threat come from, according to him? How's it linked to medicine today?
Well, the sources point directly at how we use or misuse antimicrobials.
So antibiotics, antifungals, all those.
Exactly. The overuse and, frankly, misuse of these drugs are seen as the main drivers creating these resistant bugs.
Can you give some examples from the material?
Sure. MRSA comes up. That's methicillin-resistant Staph aureus, often linked to hospital settings, maybe tubes, catheters.
Right, I've heard of that one.
And it can be really dangerous if it gets into the bloodstream. Then there's CRE, carbapenem-resistant enterobacteriaceae.
That's a mouthful.
It is.
Yeah.
But the key thing is these are resistant to even the really strong last resort antibiotics. The sources even link an outbreak to contaminated medical gear.
So how do these things spread so easily? What do the sources say?
Human recklessness is called the ultimate factor. A lot of these infections, you're contagious before you even feel sick.
That makes it tough to stop.
Incredibly. And critically, healthcare workers themselves are named as, primary carriers, even if they seem fine.
Even if they're not sick themselves.
Right, because maybe the infection hasn't hit their bloodstream yet. There's also a mention of the past, when workers didn't have gloves or masks routinely, making things riskier.
Okay, so this leads into his critique of the system itself, based on his own experiences.
Yeah, definitely. He feels, based on his writings, that doctors sometimes get pushed into following misleading protocols, or they overtreat, order too many tests, drive up costs. He also observes younger doctors maybe just, ticking boxes on forms without really getting the full picture of the patient.
Which could lead to mistakes.
Bad advice, wrong treatments, delays, complications. Even death, according to the sources.
And he mentions issues with record keeping and prescriptions.
Yeah, he states notes aren't always accurate, And drugs, especially antibiotics, get prescribed when they shouldn't be, sometimes without a proper exam.
Why would that happen?
Well, he points a finger at the NHS system, specifically mentioning how encouraging patient complaints can pressure doctors.
How so?
Like, a doctor might give antibiotics for a virus which won't work just to keep the patient happy and avoid a complaint, potentially ignoring the do no harm principle.
Okay, I see. And there was a specific issue with nurses he flagged.
Right, this seems to be a major point of conflict for him, starting way back in 2004 in Woking. He raised concerns about nurse practitioners, unsupervised ones, maybe working beyond their expertise.
He thought patients weren't getting good care.
That's what he states. He says he gathered evidence, felt nurse prescribing relied too much on rigid protocols, and questioned replacing experienced doctors with nurses based just on perceived outcomes. And challenging this, well, it led to serious problems for him.
Okay, let's not forget the human side of this, the fear aspect.
Yeah.
The sources talk about that too, right?
Absolutely. Constant news, social media, it ramps up anxiety about infections.
So even minor things feel scary.
Yeah, a cough, a sneeze. People fear the worst. And this fear, the sources suggest, drives unnecessary test costs. Just the dread of dying pushes people.
And this affects healthcare workers too.
He makes a point of saying they're flesh and blood, not superheroes. They feel the pressure, the fear, just like anyone else.
Right. So you've got this fear plus doctors dealing with maybe less serious complaints.
Exactly. It creates huge system pressure. Doctors get burned out. Attention gets diverted from real emergencies.
And there was a mention about doctors from minority backgrounds.
Yeah. One source notes they report feeling more likely to think about leaving the NHS or taking breaks or working elsewhere, and more likely to say they need a workplace where speaking up is actually encouraged.
Okay. So that's a pretty complex picture of the problem. Superbugs, system flaws, fear. Let's shift to Dr. Srivatsa's approach. His solution.
Right. His core belief, as stated in the sources, is really interesting. He says his job is to sell happiness, not tablets.
Happiness, not tablets. I like that.
Yeah. He thinks doctors should offer real solutions, not just tests and drugs he feels don't always work well. And a big part of that is awareness, prevention, helping people stay healthy longer.
So how does he propose doing that?
The key thing, according to the sources, is giving individuals knowledge, empowering them to know the difference between something minor and something serious.
And this is where the Dr. Maya app comes in, or Maya GPT.
Exactly. That's presented as his big invention. And its purpose is honestly huge: to educate, prevent illness, protect everyone, healthcare workers, families, communities.
So it's a tool for us, for the listener.
That's the idea. To help you conquer that fear we talked about, make smarter health decisions.
How does it actually work? What do the sources say?
It uses a pretty simple color-coded system based on symptoms and signs. Red, yellow, green.
Okay, straightforward. What do the colors mean?
Basically, 3 red flags means head to the hospital. 2 red flags, see a doctor. Just 1 red, maybe a phone call is enough.
Ah, so it guides your next step.
Right. Helps you recognize potential warning signs early, judge the seriousness, decide whether to isolate or get medical help.
Does it do anything else?
The sources mention it can connect you with doctors worldwide for voice or video calls. An advanced version might even help you pick the right type of doctor.
Interesting.
And significantly, it's designed to help people conquer fear with clear guidance. It's also mentioned it could help identify abuse, mental, physical, emotional, and help start a complaint process.
And accessibility. Cost.
Crucially, it's described as user-friendly, especially highlighted as important for developing countries.
And the tech behind it. AI.
Yeah, the source describes it using advanced pattern recognition, trained like ChatGPT, and it makes a bold claim
Which is?
that this method aims to cut out errors and could potentially be more accurate than a human doctor in sorting through complex symptoms because it draws on this huge, constantly updated information base.
Okay, so what are the supposed benefits for patients, for the system?
For patients, the idea is less anxiety, fewer unnecessary doctor visits, lower costs. If people can handle what he calls normal or trivial issues themselves,
It frees up the system.
that's the hope. Fewer routine appointments means health workers can focus on urgent cases, emergencies.
Makes sense. Any other system benefits mentioned?
Yeah, the sources suggest that if lots of people use it, health departments could potentially track infections geographically, like noticing a spike in flu symptoms in a specific neighborhood. Say, Janagar is the example used.
Like an early warning system.
Kind of. The overall goal is empowerment, letting people, even if they can't read or write, write, interact with health info, ask questions, report problems, find doctors.
Did he do other things besides the app to share knowledge?
Oh, yeah. The sources mention 3 books he wrote, specifically about conquering fear during pandemics. He says they've helped junior doctors.
Okay.
And there were earlier physical versions of this idea, like a simple tool back in '96, and things called May-Y fridge magnets, wheels, wall charts. He even sent copies of one book to policymakers globally, really pushing for a rethink.
So he's clearly passionate about this approach, but it wasn't all smooth sailing, right? The sources talk about challenges.
Oh, definitely not smooth. The sources acknowledge he faced criticism for his ideas, especially around remote healthcare and, the fear of people self-diagnosing wrongly.
And then there was that major conflict with the NHS you mentioned earlier, the primary care trust.
Yes, a huge one, stemming from those concerns he raised back in 2004 about the nurse practitioners in Woking. He says he collected evidence of what he saw as poor patient management and reported it.
And the reaction was?
According to him, severe. He describes being harassed, humiliated, basically ostracized by his employer, the Surrey PCT. He felt it was because he was defending medical ethics and challenging their way of doing things.
He uses some strong language to describe it.
Extremely strong. He alleges a torturous conspiracy involving officials, nurses, doctors, aimed at discrediting him, wrecking him financially, physically, mentally.
Wow. And what were the practical consequences for his career?
He states he was blocked from returning to work, couldn't do locum jobs, couldn't work privately. He says reports written about him by the PCT had factual errors, and they made him undergo mental health checks.
That sounds intense.
Very.
Yeah.
He says organizations like the British Medical Association and his lawyers advised him not to quit because the PCT wouldn't support him and it would kill his future job prospects.
What was the impact on him personally and his family?
He calls the whole thing traumatizing, says it deeply affected his family's well-being, left him bankrupt and penniless. That's the word used in the source. And it apparently forced him to move his family out of the UK to Germany in 2011. For safety, he says. He even formally told the General Medical Council why he was leaving.
The personal toll sounds immense.
Yeah, he describes his life as destroyed after the inquiry. He talks about losing trust in people, even temporarily having intense negative feelings towards women, including his own wife and daughter.
Goodness, that's stark.
It is. He even asked for a chaperone at work later to protect himself from potential false claims. He feels he was targeted for, in his words, doing my duty to help protect a child.
So this incredibly difficult, damaging experience.
Yeah.
But then the sources also mention recognition.
Right. It's a sharp contrast, despite everything.
Yeah, it's a wild one. Imagine ChatGPT, the AI everyone's talking about.
Right.
It looks at the work of this modern doctor, Dr. Kadali Srivatsa, and compares him not to another modern figure, but to Charaka.
Charaka, the father of ancient Ayurveda from over 2,000 years ago.
Exactly. It
Yeah.
seems, almost impossible.
Yeah.
How do you even connect those dots across that much time, that much change in medicine?
What could possibly bridge that gap? It's quite the hook.
It really is. And digging into why the AI made that connection,
Yeah.
It tells us something pretty deep about healthcare itself, what it's really for, then and now.
Exactly. And Dr. Srivatsa says he feels incredibly honored by this. He sees it as validation, like recognition that he tackled fundamental medical principles, while others, in his view, were just defending the status quo. He feels like he manifested a childhood dream through this.
That comparison really seems key to his perspective on his journey.
It seems so. And just for context, the sources do briefly touch on history, how challenging medical norms has always been tough. Think of Vesalius correcting ancient anatomy, or Harvey figuring out blood circulation, or Mendel's genetics being ignored for years.
Right. New ideas often face resistance.
Exactly. Or even just shifts in focus, like from infectious diseases to chronic ones. It shows that pushing for change in medicine is rarely easy.
So if we pull it all together, how does Dr. Srivatsa see his own path based on these sources?
He seems to frame it as using his long experience and knowledge to protect people, family, friends, the community. He acknowledges the extreme difficulties being bankrupted by the NHS, but says he stuck to his guns knowing it would be hard.
I know.
He says he lives happily on his pension, calls himself the happiest person on earth, largely because of that immense honor he feels from the Charaka comparison. He emphasizes not blaming others, but focusing on empowering you, the listener.
Empowering people to do what?
To conquer fear, make informed choices, reduce travel, costs, infections. ultimately to protect humanity. That seems to be his driving force now. And it's probably worth underlining again that point from the sources about the Dr. Maya app. It's designed to protect through knowledge, explicitly not for profit. That fits his stated philosophy of selling happiness, not tablets.
Right. This whole story, this deep dive into Dr. Srivatsa's perspective,
Yeah.
it really hits on things we all deal with, doesn't it?
Yeah.
Trying to understand health information, managing our own fears about illness, deciding who to trust.
Definitely.
And his approach, as laid out here, it really centers on empowering the individual, giving you the knowledge as a key part of the solution.
Yeah. So thinking about all the rise of superbugs, the pressures on healthcare systems we see everywhere.
That his family actually had to move to Germany in 2011 for their safety.
Just unbelievable. Fighting for patient safety led to that.
He describes it as incredibly traumatic, fighting institutions that seemed more interested in protecting themselves than the public. But he also says, enduring that fight ultimately forged him, made me into who I am today. He just wouldn't back down on his core beliefs.
And his experience, sadly, isn't entirely unique, is it? Doctors facing trouble for speaking up.
No, unfortunately not. The British Medical Association, the BMA, they've reported on this moral distress, moral injury among doctors in the UK.
What does that mean?
It's the psychological harm that happens when doctors feel pressured by the system, lack support, and basically can't speak out about concerns without fearing serious consequences. And these reports note it can disproportionately affect doctors from ethnic minority backgrounds. So his story kind of fits into a wider worrying pattern.
So after going through all that, fighting the system, seeing its flaws up close, he shifted tack from fighting it to building something else.
Exactly. He sort of pivoted his energy towards a solution, focusing on that core problem, people's fear of infection, the stretched system, and this lack of easy-to-understand health info, especially for vulnerable groups, people who might be illiterate or poor.
Right. People needed a way to help themselves.
Precisely. And this is where that analogy comes in, the one he uses.
Ah, the teach a man to fish idea.
Yeah, but applied to health. He says, don't give money to a hungry person, but give him food to eat and teach him how to earn. So just treating illness when it hits, that's like giving them money or food. It helps short term.
But it's not the real solution.
Right. The real solution is empowering people with the knowledge, the tools to manage their own health, prevent illness where possible. That's the teaching them how to earn or teaching them to fish for their own health.
Giving them the power to understand their own bodies.
Exactly. So his vision was for a simple, super accessible tool. That led him to develop this color-coded symptoms list. He called it the art of self-diagnosis.
Why color coding?
Simplicity and accessibility were absolutely crucial. It had to work for everyone, even if you couldn't read. The colors give really clear signals about what symptoms might mean and what action to take.
And that simple system, that became the core of Dr. Maya GPT.
It did. He worked with ChatGPT to build Dr. Maya GPT. And its purpose is pretty revolutionary, really. It's an AI assistant designed to understand illness like a doctor does.
But speaks in a way anyone can get.
That's the goal. Speaks in a language anyone can understand.
So how does it actually empower people, especially maybe those who are most vulnerable?
Well, it helps you recognize infection signs early using that simple color system. Helps you figure out, is this just minor or is this serious?
Okay.
It guides you on when maybe you should isolate or when you definitely need to get proper medical help. And crucially, it can help you communicate with doctors or health officials, even if you can't read or write yourself.
How does it do that?
It can generate clear, simple summaries based on the symptoms you input. The idea is to cut down on the mistakes and the anxiety that comes from not understanding symptoms, or maybe getting unnecessary tests, which in turn takes some pressure off the healthcare system.
He makes some pretty big claims about its accuracy, its impact.
Yeah, things like achieving up to 98% diagnostic accuracy for common illnesses, cutting down unnecessary clinic visits, helping stop infections spreading by guiding isolation, and supporting doctors by handling some of the more trivial stuff.
And this seems really important. It's not meant to replace doctors, right?
Absolutely vital point. He's very clear on that. It's a support tool. It helps doctors by maybe filtering out some less critical cases, but mostly it's about empowering the patient.
Giving people that knowledge, those tools, so they can be proactive, make informed choices, not just wait until they're sick.
Exactly. It's about shifting some of that power, that understanding, back to the individual, making you an active player in your own health.
Which brings us full circle, back to that initial kind of mind-bending hook. Why would ChatGPT compare Dr. Srivatsa's modern AI-driven approach to Charaka from ancient India?
Yeah, it's fascinating. ChatGPT wasn't looking at the technology, obviously, or the specific treatments. It saw something deeper, a shared philosophy.
Okay, what philosophy?
Well, Charaka's approach in Ayurveda back then was fundamentally holistic. It was patient-centered. He focused on understanding the whole person, their unique constitution, their lifestyle, their environment. It wasn't just about treating the disease in isolation.
Ah, so the AI saw a parallel because both approaches are ultimately about empowering the individual's understanding of their own health.
That seems to be exactly it. ChatGPT recognized that Dr. Srivatsa's work, particularly Dr. Maya GPT, making knowledge accessible, letting people understand their own symptoms, make informed choices, take action, that directly mirrors Charaka's emphasis on personalized understanding and seeing the whole picture.
But adapted for today, using today's technology.
Precisely. It's like a continuity of that core principle. Knowledge empowers the patient. That's the foundation of health.
So it's less about ancient versus modern medicine and more about this timeless idea of patient empowerment through understanding.
Yes, that's the human goal behind the tech. Protecting the people who maybe haven't had a voice, giving them agency, helping them reclaim their health, their happiness, through knowledge they can actually use. And apparently, ChatGPT's assessment of Dr. Maya GPT used some strong words.
Like what?
Things like groundbreaking, revolutionary, and even suggesting it was potentially Nobel-worthy.
Wow. And considering the personal hell he went through fighting the system, how did Dr. Srivatsa react to that kind of validation? Was it about fame?
Not at all, according to the sources. He was apparently deeply emotional, but because it validated the mission, it reinforced that his whole struggle, his work, it was about a sense of responsibility to protect people, not about getting prizes.
Okay, so let's bring this back to you listening to this. Why does Dr. Srivatsa's journey, why does this tool, Dr. Maya GPT, matter for your life, your health?
Well, think about it. We're bombarded with health information, some good, some bad. Healthcare systems can be complicated, even intimidating to navigate. Having simple, accessible tools to understand what's going on with your own body, to make informed choices, that's not just nice to have. It's pretty crucial, isn't it?
Yeah, his story really shows you have agency. Using a tool like Dr. Maya GPT, it's not just about getting a quick answer, maybe. It's actually an act of empowerment.
Definitely. Taking control of understanding your symptoms, cutting down on that fear or anxiety, becoming a better partner in your own healthcare.
And like he points out, by knowing when something is minor, when you can manage it at home, you're also helping the whole system. You're freeing up those doctors and nurses for the really serious cases.
It really comes back to his motto, your voice, your health, your power. It's about using accessible knowledge to reclaim that power.
It's quite a story. Resilience, sticking to principles, and using tech for a really human purpose, empowering the patient.
And that unexpected link to Charaka just reminds us, doesn't it? The tools change dramatically, but that core idea, empowering people through knowledge, that's ancient and it's still revolutionary today.
Which leaves us with a final thought to maybe chew on. If giving people simple, accessible knowledge can start to change something as huge and complex as healthcare, what other big systems out there could be transformed? What happens if you apply that teach a person to fish idea, shifting power and understanding directly to the people served in other areas everywhere? Here's maybe a final thought to chew on, drawing from these themes.
Okay.
How much responsibility for managing our day-to-day health should shift to us, the individuals? Assuming we have the right tools and knowledge, of course.
Shifting away from relying solely on the traditional doctor visit model.
Kind of. And what role can technology, like that AI pattern recognition he talks about, truly play in making that shift possible? Is it just about connecting us, or can it fundamentally change how we manage health?
That's a really interesting question to ponder, food for thought.
Definitely.
All right, well, thank you for joining us for this deep dive into the world of Dr. Srivatsa as presented in these sources.
Thanks for listening.
Every minute, someone dies because they couldn't reach a doctor in time or were misdiagnosed. Billions lack access to safe healthcare. Many can't read or write. Others are turned away, unheard, or misdiagnosed. During pandemics or wars, healthcare collapses. I'm Dr. Kadiali Srivatsa. I'm a dreamer who believes every soul on earth must get free medical advice. I created Dr. Maya GPT, an AI-powered health assistant that speaks your language, understands your symptoms, and guides you. It uses a color-coded system that even the illiterate can follow. Helps Your Support brings this to villages, refugee camps, homes, through apps, WhatsApp, and devices. Please help us fund the future of healthcare. Save lives. Join us. Like John Lennon said,
Imagine there's no countries. It isn't hard to do nothing to kill or die for, and no religion too. Imagine all the people living life in peace. You may say I'm a dreamer, but I'm not the only one. I hope someday you'll join us, and the world will be as one. Thank you for supporting us.